There's a very fine line between manual therapy and ego, and they actually sit very much like this. You only have to spend a couple of minutes on Instagram and you will see a whole host of manual therapists whose egos are just astronomical. I've been victim of this myself. As a young therapist, I would see patients and I would literally crack them from head to foot. No real thought process, no clinical rationale. I was using Gucci techniques, trying to make the loudest possible crack I could possibly do. That's not treatment. That's just using technique without any real thought process behind it. That was ego. That was just fluffing up my own self-importance, okay? The bigger the crack must be the better the technique. It's not the case. You should only use manual therapy to elicit a specific outcome that you're trying to achieve. And then you reinforce that with education, exercise, and all of your other modalities. There's a fine line between your treatment becoming sort of patient-centered and then transitioning into being self-centered. Is the treatment about the patient or is the treatment about how amazing you are as a practitioner? And it's a fine balance, okay? I see so many of these internet gurus, these Instagram manipulation gurus doing these massive, loud, huge crunches and cracks, and they're jock strapping people's necks off the table. Guys, that's not real. It's not real. These are not techniques that you're going to use in clinic. You want your manipulation to be gentle, finesse over force. It needs to be, like a manipulative ninja. You want to be able to manipulate or mobilize a joint and the patient to go, oh man, that was lovely. There's no need to put so much power and brute force into it. That's there purely to get Instagram likes. Don't always believe what you see on Instagram or Facebook. Half of this stuff's got fake sounds being put into it anyway. So be careful what you're looking at. Now, and remember guys, these therapists online, they're not magic, right? I'm good at manipulation, but I'm not magic. The only difference between me and you is I've practiced more. That's it. I don't have some inane skill. I don't have some magic hands. I've just practiced more than you have. And when you practice at something, you get good at it. And that's the situation where you will be. If you're using manual therapy, just take your time. Don't rush these things. Practice. But just remember, manipulation, mobilization, manual therapy, and ego sit very closely together. Always make sure that your treatment is aimed at being patient-centered, not self-centered. I always remember the best thing I was ever taught by a tutor back in the day was, guys, leave the ego at the door. Boom.